Hi everyone, my name is Mia Harris. I'm going to be doing a case presentation on hyponatremia. This is a reply post for Desiree Freeman, who did her flashcard presentation on hyponatremia. So I'm just going to get right into the case presentation here. We have Mr. Jones, 65-year-old male with type 1 diabetes and hypertension. He's a widower, he lives alone and has 2 adult children. Mr. Jones has been experiencing fever, chills, nausea, vomiting, and diarrhea, which lasted for 2 days following dinner with friends at a restaurant. Mr. Jones goes to the ER to be seen by the doctor. So in the ER, Mr. Jones was seen by the physician, and in addition to the above symptoms, he tells the doctor that he's also experiencing headaches, muscle pain and cramps, loss of energy as well. Upon physical assessment, Mr. Jones is found to be lethargic, confused, dehydrated, low orthostatic blood pressure, which is a low blood pressure and dizziness upon standing after sitting or lying down. He also had a increased pulse rate of 112 and respiration of 20, and his sodium level was 131 milliequivalent per liter. So some diagnostic tests that can be done for Mr. Jones in this case would be a comprehensive metabolic panel or an EKG. Sodium affects the muscles, including the heart muscles as well, so EKG testing will be appropriate. So these are just the various labs that are done with the CMP, and this is all the normal value. I'm not going to read through all of this. This is just for education purposes. And I'm going to just scroll down to the next section. So in the case of Mr. Jones, his labs were abnormal with a sodium level of 131 and blood glucose of 150. Based on this information, we can say that Mr. Jones was diagnosed with acute hyponatremia. Hyponatremia is a serum sodium level of below 135. Acute hyponatremia developed within 48 hours. As we said before, Mr. Jones has been experiencing nausea and vomiting or diarrhea for 2 days, which caused water and sodium and all that electrolyte to be excreted from the body. He presents with the signs and symptoms of hyponatremia. He was dehydrated, as we already said, which is loss of fluids, causing the cells to dry up, which exhibited by the dry skin and the poor skin turgor, as mentioned before. Also, with acute hyponatremia, the sodium levels drops quickly, causing the brains to swell as well. And Mr. Jones also experienced headaches, which can be a sign of the brain swelling. Also with hyponatremia, the brain swells in response to the low sodium, leading to headaches, confusion, dizziness, and sometimes seizures or coma in severe cases. So sodium is an ion that is responsible for muscle cell contraction. So with low sodium, the brain tries to compensate by sending too many electrical impulses to the muscle cells. The cells become overwhelmed and unable to relax, leading to muscle spasm, pain, as seen in the case of Mr. Jones. So how can this problem be treated? So hyponatremia can be treated with in several ways, with sodium tablets or hypertonic normal saline, such as 3% or 5% normal saline, and this can be done with severe hyponatremia, which is a blood serum less than 120, or moderate hyponatremia with serum with a sodium level of 120 to 129. So with this situation, the goal is to replace the sodium within 4 to 6 hours. Now, you can also use isotonic normal saline, which is 0.9 0.9 NS. You can use this with mild hyponatremia. So Mr. June has a case of mild hyponatremia because his sodium level is between 130 to 134. So his is 131. So he has mild hyponatremia. So he can be treated with 0.9% normal saline, 1,000 milliliter over 10 hours, and also sodium tablets if necessary. So this is all my presentation, and if you want to just print out the templates and just read it, that would be great as well because of my accent. Thank you very much, and bye.